We're not the status quo. We want to go above what's being done in the local community. We hold ourselves to a higher regard and a higher responsibility because the relationship between a patient and a physician can be pretty personal. I constantly call my patients. Every one of my patients I do surgery on has my phone number. I call the day after surgery and they can call me whenever they want. Every single physical therapist I send a patient to, I stay in contact on a weekly basis. I'm from Michigan, was born in Royal Oak, lived in Bloomfield Hills for the first 18 years of my life, went to University of Michigan for my undergraduate and my graduate degree, went to Wayne State University School of Medicine for medical school, trained at the Detroit Medical Center, so I'm a Michigan lifer. My wife's here, my two kids were born here, my parents, a lot of family here, so I did an additional year of training in Los Angeles, where I helped cover the Los Angeles Dodgers and Rams and Kings, USA. Baseball, the Lakers, the Sparks. So it was just a phenomenal year where I worked with the highest level athletes and I realized that I could bring the same level of care that we provide our professional and collegiate athletes to every single patient I see. I have expertise dealing with the shoulder, rotator cuff and labrum, with the ankle, ankle fractures and ligament injuries, hip labral tears and injuries, but my specific focus is on the knee. I pride myself on being able to do arthroscopic work where I can try to fix a torn meniscus, ACL reconstruction, multi-ligaments reconstruction, but oftentimes as we get older, and sometimes we get arthritis, I also pride myself on being able to help people with partial and total knee replacements. So my approach to patient care is usually patients will only see me when there is a problem. So you need to evaluate the specific problem, but also the patient as a whole. What caused this problem? What can we do to avoid happening again? What can we do to solve this problem? One of the unique perspectives I bring to orthopedic surgery is being myself a collegiate athlete. I think it's one thing for a doctor to hear about somebody who trains, hear about the injury and try to figure out how to solve it. But for myself, from being a member of various sports and continuing to be very athletic, I really can understand how hard people work to get to where they are, how frustrating it is to take a step back with an injury or pain, and how important it is to get them back to the level or even above where they were previously. Something unique is my knowledge of the inside of the elbow in a picture, and when people have a Tommy John ligament tear, the work and the surgical technique to reconstruct this ligament and then the rehab to get them back to a high level of throwing. Something very unique I feel that we can offer at the DMC, which is different than most other facilities. And my goal is to get a patient back to what they like doing because athletics aren't just good for our bodies, sometimes mentally and emotionally and spiritually. They are what we need to do to live and to succeed. So I take a little different approach. Instead of telling patients what they can't do, I tell them what I can do for them to get them back to what they like doing. And I think if they trust you enough to come see you in the office, reveal their injury and trust you to treat them, then you also have a responsibility to treat them like family.